Hello, my name is Rae Hancock, Behavior Support Specialist with Montgomery County Board of Developmental Disabilities Services. Before we review part 4 of the DD Bill of Rights, I would like to take a minute to thank you guys for all that you do to serve individuals with disabilities. If you're watching this today, you're demonstrating a willingness to either hone in your current skills or to increase your base skills with more information that will help you be a better support for the individuals that we mutually serve. So thank you for your time. All right, now on to part 4. Let's jump right in. An intellectual disability is a lifelong condition that can make accessing healthcare difficult. Individuals with disabilities are often at a disadvantage when preparing and attending to their medical needs. More often, this leads to inequality with the individuals with disabilities seeking and receiving treatment. As caregivers, we have a duty to ensure that their medical needs, choices, and options are identified and reviewed with the individual often. We have to be the advocate for the persons we are assisting, whether that is by observing how they are doing on a day-to-day basis, sometimes an hour-by-hour basis, how we are providing them with information needed for their health care, and sometimes it's simply facilitating the needed medical resources that can address what they need. As a personal caregiver as well, we need to ensure that when we assist individuals with disabilities for accessing their medical needs, that they are being treated with the utmost respect and professionalism by everyone on their team. Individuals have the right to go to doctor or dentist when they need to. It is important that as support staff, we are responding quickly to when an individual is not feeling well. Individuals with developmental disabilities often have difficulties with determining discomfort, such as pain, nausea, or heartburn. Many times we notice an increase in varying emotions and or conflicts when someone is not feeling well. This is why you will hear behavior specialists such as myself say, has medical been ruled out for this individual as a contributing factor for their increase in behavior. Individuals have the right to see any doctor or dentist when they want to. We are not to convey to the individual that they don't need to. We can, however, assist with problem solving through conversation about what their options are, such as going to the emergency room versus going to a walk-in clinic or making a scheduled appointment in a clinic. Let's talk more about how to assist individuals with preparing for appointments. How many of us do not like going into appointments without having all the information? We like to plan ahead to a certain extent. It just makes it less stressful. We need to remember this with the individuals we are advocating and serving. So here's a list of examples of how we can help individuals prepare for their appointment. As caregivers, we can provide the individual with an outline of what to expect during the appointment. What we can do is just call up the office and ask, what should Jim expect for this appointment coming up? I would like to be able to convey to him the steps. Keep in mind that this should include from traveling to the appointment, sitting in the waiting room, filling out paperwork, seeing the doctor, wrapping up and leaving, and then an activity on the way home. All that is part of what to expect for an appointment. Nothing we could do is request and complete all needed paperwork prior to an appointment. Calling the doctor's office ahead of time, a week ahead of time. Hey, Jim has this appointment coming up. What can we fill out prior to this appointment to make it go quicker and smoother? Something else we could do is plan the appointment during times when the practice is less busy, such as first thing in the mornings or first thing after their scheduled lunch. In the past, and working with medical offices, this is what I have been informed, is that the beginning of the day is best because the doctor isn't behind at that point. And also first thing after lunch is a reset. So the doctor is not behind at that point either, typically. So just think about that, especially when you are working with individuals who are anxious about appointments. These times are paramount to making this appointment successful. As I said before, part of the actual appointment is, what you're going to do after the appointment. Involve the individual prior to the appointment when you're reviewing what's coming up on their calendar. Involve them in picking an activity afterwards or before, whichever one the person prefers, or before and after, whichever one would help the appointment be more successful. It could be as simple as, going to the park beforehand on a nice day, or going by and getting ice cream afterward. If you just pair the appointment with an activity that the individual enjoys, you're more likely to get that individual's participation and willingness to hang in there for the appointment. One thing that we really need to do as advocates is, if the individual is willing for us to go in with them into the appointment, is we need to make sure that the healthcare professionals are treating the individuals we're assisting respectfully and with dignity. We cannot assume that all healthcare professionals are knowledgeable on how to work with people with disabilities. We all have different skills. We all have different assets, personalities that contribute to how something goes. So if you see any signs that the individual is not comfortable with the medical professional, or vice versa, be prepared to explore a second opinion or to go elsewhere for the needed appointment. Other specific adjustments that can be made for appointments is requesting the easy read materials be provided with our individuals as their patient, so it's easier to understand the conditions and the treatments that's going to be outlined. Requesting double length appointment time with a doctor or nurse, just to allow that extra time for explanation, might be a benefit. In regards with communication for appointments, communication is especially critical. A learning disability can affect how a person interacts with healthcare staff in general. So it's important for the clinician to have a thorough knowledge about the person's history, symptoms, medications, pre-existing conditions, their diagnoses. All that information is needed. It is also important to know how the individual typically responds to, like, say, getting a shot or getting a blood drawn or asking to sit on a table. It might be helpful to seek information from a care worker, family member, or anyone who spends time with the patient on a regular basis to iron out those kind of examples that you can provide the medical professional prior to the appointment. Final point I'd like to make in this section is to make sure when the individual is communicating with the medical professional that they are speaking directly to the individuals we're assisting. We should not be the direct contact from that physician. We can help translate, we can help relay the information, but we really want to ensure that the doctors are speaking directly, making the direct eye contact with the individuals being treated in the appointment. So if you need to encourage this, you can just simply by, when a doctor speaks to you and looking at you to give you information about Jim, just turn your eyesight to Jim. If the doctor doesn't pick up on that subtle cue, then you could say, "Doctor, please speak with Jim about the appointment," and then help him translate along the way. That's just a sign of respect and that dignity measure that we were talking about earlier. Individuals with developmental disabilities also have the right to access other healthcare services like speech therapy or physical therapy if they want to. They also have the right to get mental health services if they want to talk about their feelings. Individuals with developmental disabilities have the right to get these services in a way that makes them feel comfortable. Prior to receiving care or treatment, support staff should review with the individual on what to expect. If staff are uncomfortable with any of the content, they should coordinate a conversation between the individual and the medical professional to have this conversation. At times, procedural videos can be used as a way to inform and teach the individual prior to receiving care. Just like you or I, individuals with disabilities have the right to say who and what and when a person can see information about them and their disability and their overall health care. in my relationships, I may be more willing to share my medical information with my family other than my coworker. Um, so it's okay to um, have that conversation. Matter of fact, it's needed to have that conversation with our individuals to ask them who they want to have this information and who they want to support them during their doctor's appointments. It's important that when we talk about information, we consider the consent forms that should be signed. These should be signed before disclosing any personal information. It is encouraged that the individual's provider agency permit the individual's desired staff to attend their medical appointments as well. Sometimes this is difficult due to staffing conflicts within an agency, but when all else is possible, please, ensure that the person taking the individual, number one, knows the person really well, and the individual is very familiar with that staff support as well and feels safe and secure. That way, we're more likely to have a successful outcome for the appointment. In summary of part 4, just remember that addressing and supporting an individual with their healthcare needs is one of the most important roles we have. It simply is a matter of life or death. We are not medical professionals and we should never make decisions as such. However, we do know when we are seeing changes in the person we are working with. And we know that we have a direct role in assisting that individual with communicating with others on how they're feeling. So that is where we can help. Thank you for your time today. Please let your teams know if you need support in any way. And if you ever have any concerns with the individuals that we are supporting. Thank you.